I'm Dr. Faraj Edher, and I'm going to be talking to you today about digital technology and dentistry. Now, I'm a prosthodontist practicing in Vancouver, Canada. I'm very privileged to be working at a clinic where we have the most high-tech dental technology that really exists. And what that's allowed me to see is how digital dentistry can impact every single thing that we do in dentistry. Starting from how patients find us and get to know who we are, all the way to providing a certain quality of work and a certain predictability that is almost impossible to achieve without utilizing those dental technologies. So how do we use digital technology in dentistry? Well, it starts from the very beginning. If you're a patient looking for a dentist, nowadays is very different than if you were a patient looking for a dentist 25 years ago. Because 25 years ago, the only thing you could depend on was the location and what your friends, families, relatives, strangers in the streets told you about that dentist. Today, we have these, and what you can do is Google or search for any dentist that you're going to see, and right there and then you'll see their presence online. So you'll get an idea of the services that they provide, you'll get an idea of their working hours, you'll get a sense of who the dentist is, what their staff is like, and even more recently, a lot of dentists are on social media. So if you go to Facebook or Instagram or LinkedIn, you'll probably find your dentist there. And a lot of times they show the work that they do. They provide you with some information about them as a person as well, because it's important for you to get along with your dentist. So digital technology has affected everything, including the very first step of finding your dentist, and then everything that comes after that. So the next step where digital technology has affected dentistry is actually scheduling your appointment to get in and see a dentist. Nowadays, that can be done online, it can be done on your phone, it can be done through softwares that we utilize for scheduling systems. So that's made our lives and patients' lives a lot easier than what they used to be back then. But more importantly, when we talk about the actual patient care, the actual health care that's being put in, that's significantly changed because of digital technology. So using digital radiographs, because we take x-rays in dentistry to be able to identify things. But nowadays, using digital radiographs, first of all, is more accurate, it's faster, most importantly, it allows for less radiation. So we use less radiation taking each x-ray, which is of course a good thing. Other technologies that we have, like the cone beam CT, that significantly altered how we practice implant dentistry. Here in Canada, the standard of care is to use a cone beam CT for every single implant case. The reason being, that technology allows us to actually see the bone, the soft tissue, the anatomic structures in 3 dimensions, so we can actually plan for the implant position based on that 3 dimensions, rather than doing it the old school way, which is looking at a 2D radiograph and guessing what that 3rd dimension is. We then get into the more high-tech technology that's in dentistry. So utilizing intraoral scanners. Instead of putting the goop in the mouth and waiting for it to set in your mouth for 3 to 5 minutes, we now take an intraoral scan, which is pretty much a small video recorder that records your teeth and renders them as a 3D file. That's completely substituted the need for conventional impressions in a lot of the cases that we do. We're also getting into utilizing augmented reality. So we're able to design smiles and have our patients assess those smiles right there and then on the iPad, where they take a look at things live and they see what their new smile will look like on their own face as they turn their head to the right, to the left, as they talk, as they smile, as they laugh. That's unbelievable technology that's changed the way we can communicate, but more importantly, it's allowed them to get a much clearer sense of what to expect from that treatment. What I always say is that digital technology in dentistry has affected a lot of things we do, but the number one factor that's changed and the most useful aspect of digital dentistry is communication. It's completely improved the way we communicate with everyone involved. So how dentists communicate with each other, by being able to send those radiographs and CBCTs, by how dentists are able to communicate with their lab technicians. So being able to use digital cameras, being able to use intraoral scanners. Most importantly, it's changed how we as dentists are able to communicate with our patients. because like I said, when I'm able to show my patient a virtual smile design and have them to some degree get a good understanding of what the end result's going to look like, that's a lot easier than me explaining things in words and having them try to imagine it in their heads. Another aspect of digital dentistry that's changed the way we practice is its accuracy and precision. So whether it's using those intraoral scanners to allow us to create restorations that are a lot more accurately fitting to the teeth, or using computer-aided technology to precisely plan the position of an implant using static or dynamic guides. Those are all tools that are available to us now to allow us to actually perform treatment at a much higher level of quality, precision, and accuracy.